All right. Good afternoon, everybody. So today's lecture, we're going to be going over the unit on, the unit on. Just a minute. All right. So we're going to be starting the unit on physical therapy in older adults, or in other words, physical therapy for geriatric patients, for the geriatric patient. So again, older adults or older person, this is the terminology that it's preferred. Or again, very specific, and specifically, when we're talking about the older population, this is a study of what happens in advanced age. So again, gerontology addresses this issue. So again, baby boomers, their population started to grow, increase. Um, in addition to that, people are living much longer these days. So both things combined, again, is raising the population of older people. Um, again, in 2012, in the United States at least, a 65 for a 65-year-old male, they are expected to live up until the age of 83, and women, they live till age 86. So women outlive men. Anybody know why? Why do women live longer than men? Any clues? Nobody has any idea, or you guys just like logged in and walked away from your computers? Maybe that's what it is. No problem. Uh, you have an exam that's appropriate. So half of non-institutionalized adults have difficulty with at least one of their, one of the things that they need to do, one of their daily tasks for daily living, or again, it's also referred to as activities of daily living. So that could be something as easy as, putting something in the microwave, or trying to open the door for the refrigerator, or putting on clothes, brushing teeth. Again, so again, that's a pretty big number. Half of non-institutionalized older adults, they have issues with this. So a lot of people, they also need devices, assistive devices, in order to be able to, again, do their daily activities, again, for their ADLs. Um, so a lot of people, they're not able to shop. They cannot drive. Again, aside from that, just doing their finances could be difficult. So if you can't do the basics, then that also impacts more advanced tasks as well. So again, if you look at this woman, for example, she may not be able to reach up over here. This action, all right, raising your arm, it could be extremely difficult for an individual like this. Why? Again, the muscles that require, that allow you the option to raise your arm up over here, they need to be strong, they need to be functional, and it's not just one. Many muscles uh, need to be involved in order to do that. So if you look at it, she needs to be able to stand upright also. She needs to be able to bend over forward. If there's any compromises in any one of these muscles that allow for the entire positioning of her body, she will not be able to uh, pull down a cup of water for herself. So when you see things like this, again, as a physical therapist, especially if you're working in the field, if you're doing home physical therapy, you have to look at the environment and make adjustments within the environment that'll allow your patient, your client, to be able to function as they normally do without much impairment. So again, as I'm telling you, uh, maybe at home or perform exercise classes in community fitness centers. So again, therapy, individual, you could be working with your clients at home. They could be coming to your office, or again, it could also be group exercises as well. Uh, Again, when people end up having acute uh, diseases, acute disorders, treatment is more likely to be rendered in an inpatient environment of the hospital. Now, if there's a chronic conditions, again, they require much longer durations of treatment. So that individual, their patient, you may be working or again having to travel to a long-term care facility to be able to deliver services. Or again, sometimes they're at a nursing home, which is also referred to as a skilled nursing facility. Not a hospital, but again, it's just a nursing home, skilled nursing facility. Other times, again, they could be at not a skilled nursing facility, but again, they could be at what they call these assisted living facilities. Over here, it's like the residents, they're much more independent. So it could be an apartment building. Okay. Now, within the apartment building or apartment complex, there may be some nurses, or there may be um, a singer that comes in, or they end up having like group activities for people that live within that building. So they could get some basic help to get around, and they end up having group activities, checkups, etc., etc. But again, there's no full nursing service. In other words, these individuals, they will be ambulatory. Okay, so keyword is that they're ambulatory. So if you look over here, this individual seems like looks like he's at his home, and he's doing these knee lifts, right, to help straighten his muscles. Maybe he's doing lunges. I don't know. Um, so aside from clinical practitioners, physical therapists and physical therapist assistants, uh, again, you also serve the capacity of being educators. So what is that? Again, you have to teach. You teach your client. You teach your client about, or again, their family members, uh, what they should be doing in terms of their recovery. When we spoke about this before, in getting the patient's family involved in their care. So again, it's just more or less a review of it. As a physical therapist, not only are you there to recover patients back to health, but you're also there so they don't end up getting hurt in the first place. Look, a lot of times, companies, factories, for example, they may hire physical therapists to assess why there's so many injuries, back injuries, for example, okay, or whatever work-related accident that could happen. One of the jobs for a physical therapist, they can come and evaluate and see what type of work is being done at um, or what the production line is at a factory or any given work environment, and what practices may lead to injuries, or what practices are likely to increase injury. So all these things are looked at. And again, they could be part of the job of a physical therapist. They may act as consultants. Again, they go to places like factories, or again, warehouses, or anywhere, any business, all right? And again, they can advise on what safety equipment that they may use, or what assistive devices they should implement, um, et cetera, et cetera. Um, a lot of times, physical therapists, they end up being they also end up playing the role as administrators within a clinic. So again, you may have to deal with in this role. Again, you would be overseeing, or you'd be responsible for the oversight of services that are being rendered by that facility, by that clinic. And again, a lot of those services, they would be geared towards um, uh, older adults as well. So you may have to deal with payment questions or scheduling conflicts that may arise. There's also a lot of research that goes into geriatrics, okay, dealing with geriatric patients for the physical therapist. So again, you may have a role as a researcher, figuring out, what are some of the biggest concerns for geriatrics in terms of, I don't know, hip injury or hips after hip surgery or after knee replacement surgery. You can write papers on that. You may want to do certain research on that. I'm just making things up. So again, there's so much out there. And these things that I'm making up, they're small. They're probably already been looked into. So again, this physical therapist looks like he's working with this older woman. She's got a bit of, what's this condition called? You guys should have learned this in your anatomy class. And also, I think I may have mentioned it earlier on. What is this condition? She has a humpback. What's the medical term for this? Anybody, any idea? Noor, you have your hand up. Noor, what is this condition called? Humpback.
Yeah, teacher, you said we weren't answering because the microphone was like muted for all.
Oh, raise your hand like you did.
Okay. But we don't know what it's called.
What is? You don't know what this is called? Why? You didn't.
Is it like a bad posture?
What is the name of this medical condition where this humpback? Zena. Maybe Zena knows. Let's see. Zena, what is it?
Yes. Scoliosis, I think.
Very close. Not scoliosis. Very good try though. Very good. Excellent. Anybody else? Zena, very good. But not correct. Very close. Anybody else? No, not trying. Mariam. 1 second. Okay, Mariam, go ahead.
Is kyphosis, doctor?
Very good. Mariam, kyphosis, excellent. Good job. So yeah, kyphosis. So kyphosis is what? It's excessive posterior curvature of the thoracic spine. Okay, that's what kyphosis is. All right. Very good. Did I just skip like a handful of slides? Okay, no, I didn't. So again, when you look at age-related changes, you have musculoskeletal deficiencies that also arise. So with this, again, what are they talking about? Because of musculoskeletal deficiencies, there is decreased muscle mass. So among those, when you end up having a decrease in the mass of muscle, that can also end up leading to hypokinesis. So again, this means, hypo means low, okay, kinesis is movement, so low movement or decreased movement, and sarcopenia. So sarcopenia is deficiency or decrease. So decrease, sarc means muscle in this sense, so decreased muscle mass as well. So these are the changes that happen. So now, naturally, when you end up having decreased muscle and decreased movement, that's going to lead to decreased flexibility as well. What moves us? Muscles move us. The joints that bear weight. What are some of the weight-bearing joints in our body?
The knees.
The knees, very good. What else?
Ankles.
Dana? Ankles? Somebody said?
Spine.
Yes, Dana.
Hello, joint or bones? I didn't hear that properly. Because if it's bones, it's tibia.
Somebody said that, yeah, okay, your knee joint, okay, so knee joint, at the knee joint, you have your tibia and femur that come into that form a joint over there, and that's a weight-bearing joint. Aside from that, other weight-bearing joints in the body. Somebody said ankle joints. Yes, a lot of weight comes down over there. What else aside from there? What else bears weight? What's another weight-bearing joint? What other weight-bearing
Sure,
joint?
is the spine weight?
Absolutely, your spine as well, right? Especially which part of the spine bears the most weight?
Yeah, L5, I think. The
Yeah,
lower one.
the lumbar spine bears
Yeah.
the amount of weight. Okay, not just L5, but the entire lumbar region. It's the most weight-bearing.
Yeah, I think.
Yes, it is. Good. Nuran, you had your hand up. Okay, so is there anything else? Any other joints you guys can think of? What do you think? What else?
The hips, maybe? I don't know.
Hips are also weight bearing. Good, good. Anything else? Any other joint?
I think joint of the feet.
Ankle, yeah, good. Ankle, joints of the feet.
Okay, and the hips.
Hips, somebody said also good. Obada,
Maybe
go ahead.
maybe the disc.
Which disc?
It's near to the. I mean, it's also the hips too.
The hips, yes, yes. Somebody mentioned, okay, good. Hips are also weight bearing joints.
Yep.
Good. All right, excellent. So these are all good good answers. Very good. There's also CNS changes as well, central nervous system changes. So again, there's a reduction in how fast the nerve impulses move. So that's going to end up affecting. Again, you tend to see this change in geriatric patient as well. Oh, okay. All right. Other sensory system changes, they include, again, presbycusis. You guys know what presbycusis is? What's presbycusis mean? Anybody? Presbycusis means difficulty hearing. Okay, presbycusis. So again, this is another issue that you tend to see, presbycusis, right over here. Oh, it's written here, good, presbycusis. There's also vision changes, presbyopia. Okay, presbyopia would be changes in other words, vision, a decline in vision. In other words, decreased vision just because you're getting old. That's all it is, presbyopia. So this is normal. It happens to everybody. Not everybody, nearly everybody. Some people that are older, they may not need reading glasses, or they may not need glasses to look at something that's far, something that's in the distant. Okay. So what else is there? All right. I think that is. Anything else? Let's see. Next slide. Oh, so there's cardiovascular system changes. Well, you guys are not doing. You guys. So in non-Hispanic black males, they tend to be at highest risk for developing high blood pressure. Non-Hispanic black males. So again, non-Hispanic Africans, African Americans, I would say. Are there any Nigerian students here? Anybody from Nigeria? Perfect is Nigerian. Okay, perfect. Hold on. Jemima is not from Nigeria. Okay, perfect. Jemima?
Sir?
Yes, you're perfect. Are there a lot of people with high blood pressure in Nigeria? Men with high blood pressure in Nigeria?
Men with high blood pressure in Nigeria.
Yes.
I'm not sure, but mostly women.
Women with high blood pressure?
Yeah.
Okay, interesting. All right. All right, okay. So, yeah, African American women, they also, it's usually the men in America. The women, they don't have a problem with high blood pressure. The men have much more, they're much worse. And in African Americans, I don't know how it is in the rest of Africa, in Africa. I've never looked at that. Okay, all right, very good. Anybody else from Nigeria or some of the African countries over there? Not the northernmost. They're not. It's not affected as much. Not the Mediterranean African nations. It's not affected over there too much. But again, once you start going south, you tend to see it more, especially in the Western Hemisphere. Anybody else? No? Okay. I guess not. Balance loss also, right? So again, they can't maintain their balance. If they can't maintain their balance, there's a high risk of falling. And if they fall, again, older people, they can break hips, they can break bones, they can break arms. And again, that's a long recovery. So this is something else that you need to consider. Also, again, there's a decline in cognitive function. They can't understand as fast. This is one of the issues they have. So, maybe for I don't know, like this Xbox, for example, this video game. When I was young, I used to play this really well, and I knew how to do everything. Now, for me to like open up this machine and navigate through the menus, I can't. It takes me a long time. Or to give you another example, for example, before I may be able to just buy something and assemble it without even looking at the manual. Buy anything, maybe furniture or it just could be anything that requires assembly. I would need to look at the menu. I would just open it up, understand, look at the pieces, then understand how to put it together. Now I may not have that ability. I can't do that anymore. So again, this tends to happen as people age. I'm not saying that I was just giving an example. It's not true, but alhamdulillah, I can still figure things out without reading a manual for most of the time. What else is there? People may develop Alzheimer's. That's another issue. Again, as you start increasing age, the risk of developing Alzheimer's also increases. Again, memory loss starts to increase as well. You start to forget or be forgetful. Psychosocial changes also may come into play. You may face discrimination. Older people may face discrimination. Oh, let's not wait for them. They're old. They're just going to slow us down. This could be something. Or again, just retirement. It's a bit of a difficulty for people having to accept that they are not members of productive society anymore, and that they're retired. Osteoarthritis. So when you have osteoarthritis is age-related arthritis. And again, most commonly, you're going to find it in weight-bearing joints, like, again, the knee joint, for example. Or again, the joints of your foot, and they have down big toe. Also, hands as well. Rheumatoid arthritis, on the other hand, rheumatoid arthritis, it's not age-related arthritis, but again, this is an autoimmune form of arthritis. So again, this also results in joint stiffness. Your joints may feel warm, and you end up having deformities within those joints. It could be at finger joints. It's very common to see, or wrist joints. And again, unfortunately, rheumatoid arthritis, it peaks between the ages of 40 to 60 in both men as well as women. However, it tends to be a little bit more common in women. Osteoporosis, on the other hand, this is going to be seen we tend to see this in women more so than men. And essentially what ends up happening is the bones start to get weak, all right? It's not normal aging process. So in women that develop osteoporosis, one of the main roles for physical therapists is for you guys to educate your clients so they don't end up getting injured. Okay, it's injury prevention. Now, as far as osteoporosis goes, what can women do to decrease their risk for developing osteoporosis? Anybody? What could women do to decrease osteoporosis likelihood?
Maybe play some sports and do exercise.
Okay, good, very good. Exercise, sports. What else? Abdullah. Abdullah. Abdullah Handi. You had Nuran. Nuran, go ahead. Saad. Go ahead, Saad.
Women should try eating a bone healthy like diet, full of calcium.
Very good. Bone healthy diet. All right. So lots of what?
Food rich in calcium.
Like what? I'm sorry. Go ahead. Like what? What are foods rich in calcium?
Milk.
Milk. Very good. Nadia, how about you? Nadia, what's food rich in calcium? Nadia? Abdullah? Nadia? Noor?
Yes, sir. Like fish.
Fish is okay, all right. Protein, maybe, yeah, all right.
Yes, also dairy foods like cheese, milk.
Okay, cheese is good, milk is good, yogurt is good.
Maybe green vegetables.
Yogurt is much better. Green
Yeah.
vegetables, some dark green vegetables, they're high in calcium also, but yeah, it's better off with the yogurt, cheese, and these are good. All right, good.
Dairy products.
Who?
Dairy products.
Yeah. In general, this is good.
And avoiding bad habits like smoking.
Yes, smoking also is very important. Not important. It's very important not to smoke. So cigarette smoking, this is also very important. Turkish, where's my Turkish students? Turkish girls, they like to smoke too much. So Turkish people, you have to let your clients know this is another side effect of smoking, is osteoporosis. So again, diets that are rich in, so the other part to it is, yes, exercise, important, yes. And then a good diet, yes, very important. The other part of it is starting to eat early. So again, right now in your teens, in your 20s, you should be having the higher intake of calcium you have during this age, it decreases your likelihood of developing osteoporosis in the future. Okay. So this is something that you should all understand and look at. Now, people, I mentioned this earlier in the lecture. People that are older than 65 years old, 86% of hip fractures, 86% likelihood of breaking their hips in the United States. Now, once you break your hip, it's extremely painful, and again, the recovery, it's very, very, very slow. So again, it severely impacts the ADLs, again, what you are able to do by yourself every day. For these individuals, it's very important to end up receiving physical therapy after their injury, after their surgery. And again, right away, immediately off the bat, they're focused on early mobility in these individuals. So transfer training, gait training, weight-bearing precautions, And also how they can use assistive devices. All these are very important for these individuals to learn how to use properly. So what do you notice over here? I don't think he's a physical therapist, but again, it could be maybe her husband. He's helping her exercise. Okay, so again, at home you need to do these exercises also, stretching out and whatnot. All right. The other thing that you see a lot in the older population is would be the diabetes. Primarily, we're looking at a lot of patients with type 2 diabetes. It affects about 25% of people over the age of 65. And again, what ends up happening? Their body is not able to utilize insulin efficiently. So again, it could be insufficient production or insufficient absorption. So again, there's type 1, type 2. We're not talking about type 1, type 2. We're just talking about diabetes in general. Now, if you're not able to manage your diabetes properly, that could lead to kidney failure, right? It could lead to circulatory problems. It can lead to ulcers in the skin from forming. It can lead to nerve damage. It could lead to vascular diseases and disorders. Again, coronary artery disease is one of them. It can also lead to vision changes, eye disease. So in these individuals, in the geriatric, again, when you do a history, you go through the medical chart, you look at that and you see what are the other services that this patient is receiving or have received in the past. Also, you find out about their family history also. Try to see what their cognition level is, what their social history is. And then, of course, you do an ROS, review of systems. And again, you see over here the physical therapist, he's doing an examination here. This might be the PTA who's documenting. And this guy's just kind of smiling and observing. All right, so as far as tests and measures go, one of the first things you look at is the range of motion. This is what you'll assess. So again, look at the context for the older adults. Okay, when you check for the range of motion. Now, when you're doing sensory testing, you want to include both proprioception. You look at how well they are with touch as well. And you call that serognosis. You look at their vision, audition also, how well they can hear. Standing still, their movements. You look at these measures as well. Again, this individual, it looks like, again, he needs a cane to balance himself. So this is the job for this woman. And it looks like this belt is connected to, I don't know, it might be a device that's kind of suspending him in case he falls, and the physical therapist is just there to kind of help spot him. Okay. So you should also be looking at the cardiovascular and pulmonary examinations to understand what their aerobic capacity is. All right. So again, you don't want to do so much exercise or so much where you're not able to, their heart's not able to support it. Or again, they can't breathe effectively in order to do specific tasks. All right. Maybe they can just walk up 3 flights of stairs or 1 flight of stairs before they need to stop, or this is their capacity. They're not able to do 2 flights of stairs. Okay. And we're looking at standardized testing. Right. So standardized tests, they are developed to look at the outcomes as patients. They're trying to move towards their they move towards different environments. One of the things that are looked at is a functional status questionnaire, the FSQ. It's also a functional status index that may be utilized. So the physical therapist, they observe and then they'll record the scores of the performance. Right. So again, they look at the physical performance test, PPTs. Also, again, when you're doing this, you have to consider the differences between a social environment as well as a home environment. So again, aside from they should be assessing signs and symptoms, syndromes that may be related to pathologies. You have to come up with a prognosis. Again, what's the maximum level of improvement that you may expect of the patient? Be realistic. Again, you want to develop goals for that patient, functional goals, to make sure that they can, you can restore as much movement back as possible to the point prior to the injury or prior to the pathology. So, what's your plan of how are you planning on achieving it? You make a plan here to achieve these goals. So, what are some of the interventions that could be done for the geriatric patient? So again, education. That you teach them, you give them instructions, not just the patient, but also the family. You include them, or anybody else that's involved in giving care to that patient. And again, the intervention, it focuses on improving their daily functioning. You can take exercise programs and modify them to suit each patient's needs, so you can customize them. So they're telling you, you should consider modifying these environmental modifications, both, in adaptive equipment as well as in the settings that they're in. Are they at a home setting, a hospital setting, inpatient settings? So it changes accordingly. What else? All right, let's go to the next slide. Wait, hold on. What was this? All right, the other thing they have listed over here is this. They've got written down here. Include information or instructions in health promotion. Consider medications that could impact rehabilitation program. Certain medications, they may actually enhance a rehab session. Okay, so pain medications before an exercise, it may decrease the pain, which will allow the patient to be more productive in their therapy. Other times, for example, other medications, it may make the patient very sleepy, and if it makes them sleepy, then it's going to be counterproductive to their therapy session. So you want to consider this as well. Again, in this photo, this individual is helping this woman stand up, I guess. That's what they're working on. Yeah, I guess that's all that's happening over there. Nothing too much. Oh, here, look, they're using these parallel bars to help walk. This is good also. Here, you can support yourself on both sides. And he's standing behind her. He's got the belt on her, so if she does fall or fall forward, he can grab the belt. Hopefully strong enough so he doesn't fall down with her. Again, it's when somebody has no, again, I don't know how many kilos she weighs, maybe 60 kilos, 70 kilos. Having to support 70 kilos that's falling with momentum forward, it's much harder than you think. So again, body mechanics, body positions, you need to learn how to brace yourself also and how you should position yourself to be able to support this woman so she doesn't end up sustaining an injury. Hopefully you guys learned that in your lab classes. So also you look at ethical considerations. Older people, again, they're vulnerable to abuse, to elder abuse, to blackmail. This is very common. And again, this could occur in the form of neglect, could be emotional neglect, psychological neglect, physical neglect, or even financial exploitation. All these older patients are subjected to. Okay, so that is it for this week's lecture. Let me stop this. Okay.